Good morning and welcome to another session of iPros TV. My name is Juan Carlos Gallardo, President and CEO of iPros Insurance Professionals. And today we're going to be talking about a really hot topic in the industry, which is the duals transition. There's a lot of questions that are out there. There's a lot of misinformation, a lot of confusion. So today our attempt is to clarify some of those hot topics that the agents are asking us as an FMO as well as the carriers. And I have three very special guests, three very special partners of iPros Insurance Professionals. And I'm going to start to my right here with our dear friend, Elsa Haro-Rapp, the broker account executive for Scan Health Plan. Good morning, Elsa.
Good morning. I'm so excited to be here and thank you for putting this on today.
Thank you so much. We also have Dr. Jezabel Yrbina, Director and Sales Strategy and Services for LA Care Health Plan, which is the largest public health plan in the country. So we're really excited about getting her insight from a public organization as well. Good morning.
Thank you, Juan. Happy to be here and answer all your questions today.
Awesome. And last but not least, our friend Shaina Popkin, Associate Vice President of Sales of Brand New Day. Welcome, Shaina. We're looking forward to hearing a lot from you. I know you're out in the trenches every day, so looking forward to getting some insight from you.
Thank you so much. Excited to be here.
Awesome. Great. So today's session, conversational panel discussion from our experts. We have a series of questions that we're going to be asking them that were submitted by our agents that hopefully address all of the questions. But I invite you at the end of our Q&A session to anything that we missed, please feel free to ask those additional questions. Anything that we don't know, we'll definitely take that away as a homework assignment and get that information back to you. So we're going to start with Brand New Day today, Shaina. We're going in alphabetical order.
Great.
So we're going to start with you today. And we're hearing a lot about D-SNP lookalike plans, and I'm getting definitions here and there, and they don't all align. So Can you give us a brief definition of what is a D-SNP plan?
Yeah, D-SNP lookalike plan is a plan that's filed as a Medicare Advantage plan, but it has more than 80% duals. So it's not a true D-SNP. It's a Medicare Advantage plan that has more than 80% duals enrolled into that plan.
And Brand New Day obviously qualifies in that parameter.
Yes,
Wonderful.
we have one plan.
We know that we're all going to be impacted as a result of these changes. Does Brand New Day have any plans that are going to be directly impacted by these changes?
Yes, we have our Classic Choice, Plan 33. That's our only lookalike plan in California.
Okay. What options do agents have with their current clients currently under this Plan 33?
Yeah, so we have a great option. We're the only one in the state of California that has a C-SNP for duals. And what that is, it's the Embrace Choice, 40-1 for Southern California and 40-2 for Central and Northern California. And for those members, if they have cardiovascular disease, high blood pressure, diabetes, they can enroll into that plan today. And that's completely safe. Since it's a C-SNP, it doesn't have to follow that 80% rule.
And of course, you have to stop right when I'm having a drunk.
Sorry. Yeah. So it's a great option. It still is designed like a D-SNP, but because it's a chronic special needs plan, it's allowed to stay and has awesome benefits for your dual eligible clients that have a chronic condition.
Awesome. Yeah. And you and I had a conversation yesterday afternoon in preparation for this session around hosting some carrier specific iPros TV sessions. Yeah. So we'll be scheduling some time, not only with you, but with LA Care, Scan, and some of our other partners that are going to be impacted by this transition. So we can dive a little deeper around the plan options, around what Brand New Day is doing internally. Because as you all shared your PowerPoint presentations, there's no doubt that organizationally you each have a plan for the transition. So that's great to see. And I think part of this session is also putting our agents at ease that the health plans are looking out for them as an agent and as an agency, right? Yeah. So I think one of the common themes that I heard in interacting with our agents is it's that peace of mind that their book of business is being protected. We all know we work hard. This is a population that's really targeted frequently for many reasons. So I think that this line of communication is really important. I want to move on to our next question here. And can we already see that there are going to be we can already see that there's going to be a lot of confusion as part of this transition. From a proactive standpoint, what are you recommending that agents can do now?
Yeah. So start having those conversations with your clients now that there are changes. You're absolutely allowed to tell them that there are changes going on in the marketplace. They're going to get letters from the health plans, from Medi-Cal, from the state, from competitors, other health plans, other agents. So to protect your book of business, just reach out to your clients, re-engage with them, and let them know that you'll take care of them this AEP.
And there's some concerns around compliance. I want to inform our agents that as long as their agents are their existing clients in their book of business, it is okay to reach out, right?
Right. And you're not allowed to talk about the new plans, right? Because it's October 1st is when you can talk about 2023 plans, but you can let them know, hey, this AEP, we do need to meet. We do need to talk about the changes because we need to make sure that either we're going to keep you on the same plan. If there's a transition plan, which Branding Day does have, for any of our lookalike members that don't qualify for our CSNP, we'll be crosswalking those members onto a new plan that is CMS approved and designed to be competitive for duals. So just, again, outreach to your clients and let them know, hey, we need to talk this AEP.
You talked about the different communication that's going back and forth. This week alone, I had 2 agents forward me photos of different medical groups that are sending out letters, which obviously causes more confusion, right? When you throw in medical groups getting creative on what they're putting down in these letters to individuals, many of the letters in English when we have a high Spanish population. What do you guys do? What is Branding Day specifically doing when it comes to medical groups and keeping them in control, so to speak, of the messaging that's going out there? Because some of the letters I have can seem very confusing to a beneficiary.
Totally. So as a health plan, we don't have control over what the medical groups send out. It's their patient too at the end of the day. In our joint operation meetings that we're having with our medical groups, we're asking for the transparency. But again, that doesn't always happen. So we're asking for it. We hope that they'll be, willing to work with us on the messaging, because at the end of the day, we want to retain those members. They want to retain the members. We have common goals. So,
So speaking of common goals, I think that's a good segue for our next panelist, Jezabel from LA Care Health Plan. LA Care, a lot of times is referred to as a lookalike plan, which they're not. They are their own individual program. Very familiar with it during my days at LA Care Health Plan as a pilot program, right? Really around coordinating the Medicare benefit and the Medi-Cal benefit as one. LA Care proudly was one of the participating brokers for FMOs with LA Care. So we're very, very familiar with the product. We're very sensitive to the population, being that we've been servicing the Medi population as an organization for almost 10 years, and as an individual basis, I've been working with the Medis for over 25 years. So I know I'm very sensitive to that. And one of the reasons why we wanted to invite LA Care Health Plan, because that's another buzz as part of this transition. Is LA Care going away? Is LA Care going to have alternative programs or products? The industry sees maybe LA Care as that golden opportunity to move membership out of CalMedi Connect. I know you and I have had offline conversations and some of the creative stuff that some of the agents, some of the other agencies are doing around LA Care. So I think it's a great opportunity for those agents that are joining us today that have a CalMedi Connect book of business with you on what they can do, right? Jumping into the questions, we know that LA Care is part of CalMedi Connect. That's sunsetting at the end of this year, correct?
Yes.
So effective December 31, it goes away. We talked about the duals transition, right? I think that's the informal, but correct me if I'm wrong, but when it comes to California, CalAIM has a little bit to do with this transition of the duals. Can you tell us a little bit about that?
So CalAIM stands for California Advancing and Innovating Medi-Cal. And it's a 5-year long-term initiative launched in 2022 going through 2027. But I just wanted to give some historical context on that because realistically, California has been trying to reform Medi-Cal for a while. This started even with CCI, the Coordinated Care Initiative, back in 2014. And that the Cal Medi-Connect program was actually part of that. Only issue is that it was only, select 7 counties. So not every county in California, had a Cal Medi-Connect plan. And also, it was meant to be that single payer model that made just everything more streamlined and efficient. LA Care is the only health plan who actually had brokers selling the Cal Medi-Connect product. So, we often got feedback, it wasn't very popular because, you had to call healthcare options for enrollment and it could be a little bit tedious. But fast forward now with CalAIM, again, we are restructuring Medi-Cal. So there are, 3 pillars to that really, which is, the objectives of the CalAIM project. One is to identify and manage comprehensive needs through whole person approach. Second to that is to improve, quality outcomes and reduce disparities through value-based care and payment reform. Okay, that's very important as well because we hear this term a lot, value-based care, right? What's value-based care? So value-based care really, bottom line, it's meant to reduce health expenditures, cut those costs while still having better health outcomes. And it's just better for the member in general. Back when, or even now, fee for service, I think for a long time, providers, it was sort of like a free for all, right? So, providers were able to bill Medicare and Medi-Cal separately. But now with value-based care, which is part of the, CalAIM initiative, you have your managed care organization really helping cut those costs while providing quality care for their members. And then that third pillar is, just making Medi-Cal more consistent and seamless. So that is, now that the Cal Medi-Connect program is sunsetting, with a true DSNP, there's that very seamless coordination by having the same parent organization managing both the Medicare and the Medi-Cal. So really, that was, part of the effort of the CalAIM initiative.
Very heavy on coordination of care, right?
Yes.
And I think at its core, these changes come around calling out maybe the Medicare Advantage plans that don't have that Medi-Cal contract, for example, in California or in any state, because we do have some agents that are from Colorado and Arizona joining us today. I think at its core, it's all about coordinating the Medicaid program along with the Medicare program, right? And those plans that are now participating in this new transition have that component, right? Coordinating both. And I want to apologize to Brand New Day and Scan. As you're speaking, I noticed that we only have the LA Care pop-up banner.
Yeah, I did
that wasn't by design.
It's okay. We'll get you a Brand New Day one.
That's a message that we need your banner. So that'll go. That's on our production team. That's on our production team here. That I'm sitting there looking at you, Dr. Jezabel. Let's say
I caught it earlier.
All right, we're all a big happy family. Next session of iPro TV, and we have our panel discussion. We'll make sure that we have all our carrier partners well represented. Going back to CalAIM, this transition, what does it mean to CMC? What is to the Cal Medi-Connect program? What is LA Care Health Fund specifically doing to get in this market, back in the market? Because during my days at LA Care, managed that product, our DSNP, which on the record here on live on the air, they should have got rid of it to begin with, but they're coming back, which I'm really excited about that. So tell us a little bit more about that.
Yeah, so the CalAIM initiative really is requiring those Medicaid, Medi-Cal managed care organizations to develop DSNPs, dual special needs plans. So the Cal Medi-Connect program, our plan will be sunsetting December 31st, and all of our Cal Medi-Connect members will be automatically transitioned to a DSNP. So we will have a true DSNP. We'll have, and we'll discuss this in probably, the next question, but network will have, similar or better network. We're going to have amazing benefits. Really what we wanted to make sure that there was no interruption in care. We'll be sending notices, to our members in September that it will be a seamless transition. You don't have anything to worry about. You don't have to make any changes.
And I'm hearing a common theme between you and Shaina, automatic transition. So is it safe to say retention?
Yeah.
educate your beneficiaries that nothing's broken, leave it alone. Things are going to run smoothly and transition over, right?
Yeah, and I think even though it is a smooth transition, an automatic transition, even for us, I think there's still a big opportunity to educate your members because, there is a lot of misinformation, like you already said. But on top of that, agents aren't the only influencers. There's also the providers, and sometimes they're confused and calling their members like, well, I was told LA Care is not going to have a plan anymore. I don't want to lose you as a patient. So, let's put you on something else. So, we are being very proactive and working with our provider groups, with providers that have a large chunk of our CalMedi Connect membership and also educating our members and sending them notices as well.
So is it safe to say that the medical groups are jumping the gun based on CMS timelines on when the notices should go out? Is that what's happening then?
Technically, they're not supposed to announce that their plan is going away yet, is my understanding.
Yeah. So they will have some communications, but I think it's also the providers jumping the gun also and kind of, having those conversations with their patients. Like, this is what I heard and you need to, change your plan and whatnot.
From a proactive standpoint, should we be working with you as the liaisons, us and the health plans and the compliance departments and the provider network operations? Should we surface these letters so proactively you guys can turn around and say, hey guys, you're not helping this already confusing transition, or what can we do proactively?
Well, you can absolutely, work with the health plans directly. We know we can provide you list of the existing membership you already have, so you can start reaching out to your members. But on top of that, it's possible you have current relationships with certain providers that we're trying to reach out to. So of course, we want to make sure that, we collaborate and work cohesively and not, overstep each other in those efforts.
Awesome. And I heard something around September. Is that when the official notice has gone out? I think it'd be really helpful if we can get the timeline so that we can distribute it to our agents so that they have a heightened sense of when those notices are going to be going out.
Sure.
Right?
Absolutely.
Let's talk a little bit about network. And I wanted to ask Shaina, and I'll ask you both, and I'll start with Shaina. From a network perspective, seamless? Same
network. Yeah. So the new plan that our duals will, or Plan 33, the lookalikes, will transition to exact same network. Okay. So the only thing that they need to worry about is getting their new ID card. They'll get the communication in the mail. Other than that, it will be a seamless transition for them. And you, the agent, remains agent on record as we crosswalk those members over. Yeah.
Fantastic. LA Cares Network.
Yeah, so part of the CalAIM initiative also said that once we transition our CalMedi Connect plan over to a DSNP, we do have to have similar or better network. So, because we're still securing contract negotiations, that's really what I can say. At least similar, but better.
Fantastic. Hello.
Hi, I'm here.
Tell us a little bit about your network.
I may not have a banner, but I'm here.
Tell us a little about your network.
So the network is identical, so that makes it very easy for the transitioning and crosswalking. And of course, you are always the broker of record. So that will not be a hiccup of any type. You will not get any calls from your client saying, my doctor's changed, my medical group changed. That's going to stay the same. It'll just be, like Shaina mentioned, a change of card, a different name, a different plan name on the card, but the plan is the same. And I think, to me, as a broker, you really should be messaging your book of business and letting them know that you are their advocate. You are the person of contact that they should come to first. If you're talking, and I have to tell my brokers, when you talk to your kids, you have to be specific. You say, at the market, at the pharmacy, if someone's talking to you at the doctor's office, you name all scenarios that if they're telling you your plan is ending or you need to make a change, this is the person you come back to have the conversation. Because I think if we don't put in those clear terms, they'll say, well, it's someone at the doctor's office or my pharmacist said to talk to them. These are people that they trust. But I think it's good messaging we should be doing as best practices with this vulnerable population always. So yes, that is my messaging and mantra to brokers. touch that book of business, give them the
Retention.
scenarios, and make sure they know to contact you always first.
So let me just reiterate, retention. Contact your members. Don't sign anything. If you have any questions, call me directly. Call the health plan member services departments, right? They have good information. They'll be able to calm their nerves that everything's okay, that there's going to be a transition plan, right? And then you have the OEP the AEP, and they always have the OEP, right? To make corrections on bad choices, right? Should they move? Mm-hmm. But again, retention. Let me circle back to you, Jezabel, around the lookalikes. In reviewing the slides and preparing for today's session, I really like the way you broke down a little further than what Shaina shared with us on the DSNP DSNP definition. Can you share us a little more?
Sure. So, by definition, True DSNP has the same parent organization managing the Medicare, and the Medi-Cal. But I would just advise, agents just to be very cautious and be informed on how it affects any particular plan. Because just because a plan doesn't have a Medi-Cal contract doesn't necessarily mean they won't be able to retain a DSNP and grow their membership. And so, I definitely recommend that if you have a book of business with an organization, a carrier who you think may be impacted, you really find out, because you have those that, they do have a DSNP or they have something very, very comparable in which they will be able to transition members. The last thing you want to do is make unnecessary movement. And then, you have plans like SCAN, who has, a FIDI SNP contract, which is fully integrated, dual eligible special needs plan. So they will be able to, still business as usual, have their DSNP plan. So I definitely recommend that everybody just, do your homework, ask a lot of questions before you make any unnecessary movement.
Yeah. And talk about doing your due diligence, doing your homework. I invite agents to submit their questions. We get a lot of questions through broker support. We get a lot of questions through our business development managers out in the field. But we got limited questions for this session. We didn't get enough questions that we thought we were going to get. I don't know if it's out of shyness, whatever it is, but ask these questions. It's so important. I think the successful agents are the ones that become a master at their crafts, right? They really understand all the elements of Medicare. They have a little bit of flavor for Medicaid, but just it's about becoming a professional, right? Like in anything in life. Really embrace it if you want to be successful in this industry. And speaking of successful, our next panelist from SCAN Health Plan, Elsa, has been a very valuable partner to iPros, a wealth of information. Like our other two partners, SCAN is one of our core marquee plans. No doubt that SCAN is going to be affected by everything that's going on. Can you tell us a little bit about how this is specifically impacting SCAN?
Sure. So we have a plan that's also going to be sunsetting. It's our Plus plan. But as everyone has been mentioning on the panel, that we are proactively reaching out to your clients, assisting them with your transition now, sending you out your list of book of business so you can help us identify which ones will be the best match to be put on the fully integrated dual eligible special needs plan that they can currently move to now. So we're doing all these things that way you can be part of the process. I would say the question I get from a lot of brokers, because we do these monthly state of the duals where we invite brokers, we invite our provider partners, but the question that comes up, we always say, there's no need to move them now. And also not talking about the changes till towards the end of the year, but I'll get brokers that'll say, but if I want to move some of these clients, can I? Absolutely. It's your book. They're your existing clients. If you feel there's a better plan out there, that's the whole principle of insurance, putting someone in a better place. So absolutely. But what we do want to message to our brokers, we have brokers and agents that have 200, 300, 400 plus members. We want them to know we're going to be doing the heavy lifting. We're going to be transitioning them. You're going to stay the broker of record. So I think sometimes we have to message on different levels for that individual broker that has the 5 clients that they're worried about. And then these heavy hitting brokers that have really big books that we're going to help them and support them along the way.
And I think when we talk about movement, does it really make sense to move these members, Shaina? To me, it doesn't make sense. It seems to me that the health plan's working to protect the member through this transition.
Yeah.
It seems like the plans have maybe apples to apples or close to apple plans? Tell us about that.
Yeah, in our plan, since the better plan is the Embrace Choice Plan, the C-SNP for duals, it actually does have better benefits than the lookalike and more clinical care for someone who qualifies, again, through cardiovascular disease, high blood pressure, diabetes, history of stroke. So in our case, if brokers want to move it, yes, we would love that if you want to do that now. If they don't qualify or if you just don't feel like it, then just leave them there and we'll get them transitioned. So it really depends on the broker and the client's needs.
And I'd like to focus on those agents that want to anchor in their book of business, right?
Right.
I think some of the agents out there are going to take advantage of this confusion, that want to build a book of business and spread misinformation so that people move. Because there's really, what I'm hearing is there is no reason to really move, right?
Right.
And I think as agents out there that are attending this session and those that are going to reference this back as part of our iPros TV library, it's really an opportunity for me, from my perspective, of agents trying to take business, taking advantage of the situation. So I think for our core agents and those that are working towards becoming our core agents, it's retention. Contact your members, let them know not to worry. Let them know that we're working collaboratively with the plans to make sure that it's a seamless transition, that your benefits will have minimal to no changes on network. And yeah, just echoing that message, retention. I asked Shaina earlier, what can agents do now? I know we had, in preparing for this session, you talked about the need of contacting your clients, correct?
Yep.
You don't need to re-enroll them. Right? They're already in the system. And let's talk about remaining agent of record. Is that something that's being considered by the plans?
Yes, absolutely. So for our CalMedi Connect plan, even though they're transitioning into another plan, which is the D-SNP, that broker will still remain the agent of record.
Awesome. We're hearing a lot around IHSS, in-home support services. How familiar are you? What can you tell us about somebody that's already enrolled in IHSS and enrolling into these true D-SNP plans? Can you tell us a little bit about that?
Right. So I always tell my brokers, if you have a client who has IHSS, or the way you want to explain it to your client is a family member being paid by the state and also benefiting from the insurance that they get as a caregiver, that's really not something we want to disrupt, because families come to rely on that money financially. So you can still, in the scan scenario, you have someone on Plus, and at the end of the year, they'll be transitioned or crosswalked into Classic, where they will remain with the same network. Their family will continue to be the caregiver, no disruption and financially, and that is the best thing for them. And that's why when we sent out that list, we're asking, that was the question, like, do you know which one of these clients have in-home supportive services? I hate that we use so many acronyms in our industry. I like to just say it, because we don't want to disrupt that. We don't want to create any tension with your client by thinking we're doing the best thing, but then we're causing an issue. So we're very much being collaborative with the brokers, understanding the needs of the client before we move them into any plan, but you stay the broker record always. So
on the IHSS side, IHSS, people participating in IHSS are not eligible to enroll in certain these plans?
So here's the thing. So in a scan scenario, we have our fully integrated dual eligible special needs plan. We provide the IHSS. We provide the adult daycare. So it's not that they're not getting the services. It won't be provided by their family member being paid by the state. But I think a lot of times I tell brokers, really do an assessment, because that family member may be providing the care that they started with, but now the care is very extensive, like bathing and toileting and hygiene and all these things that go along with being someone's caregiver, that they may be willing to say, we now need someone to come in, because they still are going to be caregiving, but somebody is going to help them do the heavy lifting and provide the best care for their loved one. So it's not that there's a conflict. It's just, does the family member want to be paid by the state? That's how we typically make the distinction on which is the best product that fits the needs of the client.
Thank you. Anything you'd like to add regarding IHSS? No?
Just that we are an exclusively aligned plan. So we do service the Medi-Cal, which is in-home support services.
So through SCAN, They will continue, the family member may continue to receive the reimbursement.
With LA Care.
Got it.
Yeah.
Got it.
And since we don't have an integrated DSNP,
Mhm.
the Medi-Cal is still through the county. There's no change to any of our plans with IHSS. It just continues as is. Yeah.
Somebody that's doing the services, they continue to do that.
Yes.
Okay, and we'll dive deeper on our individual sessions because we're definitely going to have you back as guests to talk about individual benefits, individual transition plans, all that good stuff. Rodrigo, how are we doing on any questions in the queue?
There are 2 questions. I'll read them off to you. First question is, what will be the replacement name for CalMedi Connect?
I know that answer.
She's raised her hand. Come on, guys, we need to step up our game. We should have some prizes here for our guests. You got it. Talk to us.
It's
No, do you say?
Go ahead. Go
CalAIM is the name. Correct? Am I right?
So CalAIM is the initiative.
Yeah.
Okay.
Now, that is for the DSNP transition. Yes. So that's the initiative. The actual name of the DSNP plan obviously will vary by carrier, but
Okay.
that answers the question.
So more to come on what the official name will be, like Scan
because-
Connection.
Exactly.
Right.
Nice.
Got
You'll
it.
know soon.
I'll do a big reveal.
The Jezabel plan.
Yes.
I love it. Next question, please.
Thank you. There's another question. The other question is, will this transition in any way affect qualifying aid codes for the connections plan?
Once again?
Will this transition in any way affect qualifying aid codes for the connections plan? I think it's a scan question.
Right, it is
Let's
scanned.
give some applause to those technical questions. I love that. Those are good questions, guys. I love
So,
it.
no, there won't be any change in the requirement for eligibility. You'll still have the aid code and the county code that's requiring you to have that eligibility prior to writing the enrollment.
And the question may be premature on the LA Care side. Any impact on aid codes to enrolling into the program that you're aware of?
Yes, actually. So for the CMC plan, there was aid codes that were a requirement. So that will be going away. Now, some of the requirements for the CalMedi Connect is that, you had to be 21 years old. You couldn't have end-stage renal. You couldn't have certain aid codes. And so all of that is essentially not going to exist anymore. Now with the DSNP, it'll have the same qualifiers as any other DSNP. You can be under 21. You could have ESRD. And so, it's much better in a sense.
Awesome. Shaina, you take them all.
Yeah, we take everybody. Under 21, we take them all. Yeah, if they got their Medicare and Medi-Cal, we'll take them.
We'll take them. Yeah. Fantastic. While people think about any other questions that they want answered, we did gather some questions. Want to congratulate Sherry Tong and Pilar Cano, who's 2 of our agents that submitted the question. So look out for a gift card from iPros in gratitude for taking the time to really present some great questions. And I'm going to share them here with our panelists. And we'll start with Shaina, and then we'll go around. We can add to the questions. First question here is, as agents, do we need to move? And we talked about that movement, right? And it's a good thing we're repeating these things because it gets into folks' minds, the messaging, right? As agents, do we need to move our affected clients out of their current plan, or will they be transferred automatically to a new plan? And if so, that question keeps popping up, will they still remain agent of record?
You do not need to move any of your business, and you will remain agent on record.
Short and sweet.
Short and sweet. You will be fine. You will be fine.
Fantastic.
Yeah.
Jezabel, next question. Do we need to do anything proactively now?
I would absolutely say contact your book of business. I know that this is something we brought up, before, where there is already people that are probably contacting your member. So you definitely don't want to assume that just because it's going to be a seamless transition that you don't need to do anything. We've already had reported cases of members being contacted, and they will call us. They'll say, I was approached, someone came to my door.
You talked about that. I've heard that agents are actually showing up at people's homes.
Yeah. So, we've had cases of door-to-door.
Wow.
Solicitation, phone calls, LA Care is going out of business. Their CMC plan's going away. You need to find another plan or you won't have coverage. Just pretty much everything. So, obviously we are escalating those cases. They'll be handled accordingly, but I would absolutely say check on your members and make sure that you really reiterate that you are their agent of record, you are here for them, and that if at any point in time they were at risk of losing, their coverage, that you would have let them know and securely put them where they need to be. But as of now, there is no movement needed.
Wonderful. Elsa, this is a really good question. I think that there's a lot of value to this. If they are transferred automatically, will agents be informed about the specific affected members? Second part of that question, can we get a list of the clients that are going to be affected? And if yes, how do we get a hold of this list?
So the answer is yes, and we're already proactively sending out those lists. So you can be part of that collaboration and just understanding what's going to be the best plan for that client. Mm-hmm. And so I get calls from brokers on a regular basis. Thank you for the list. I'm still working on it. And so we are being proactive in sending it out.
That's wonderful. So we'll circle back with Scan on that offline to talk about that. Anything similar, Shaina, on your end that we can do?
So in our broker portal, we do have your book of business, and you can export to Excel and filter that yourself. Or if you want that list to be sent by the broker manager, just reach out to them. They're happy to pull that for you. And we can also give you a list of those Plan 33 members that qualify for the CSNP. Mm-hmm. So if you do want to move them early and they want some of those extra benefits, like a higher grocery card every month, then you can jump on that now.
Awesome. So we'll take it offline, work with each individual plan to roll out our strategy. Same holds true for
LA. We will be working with all of our GA partners directly that have that CalMedi Connect membership, so that they can start outreaching to their members.
Okay, awesome. Next question here. Shaina, if they are transferred automatically, will their benefits change? If yes, will the benefits be better, the same, or worse?
Great question. So they will be automatically transferred, all the ones that are still left on the lookalike plan as of December 31st. It depends on which area, but for Southern California, the benefits are going to be better. And we'll do a deep dive on the specific brand new day section, mm-hmm. but it still will be a very competitive dual looking mm-hmm. plan that is approved by CMS, that our product team got approved. So very competitive.
Awesome.
Yes.
Awesome. And I think this question is around those plans that don't have the FIDA SNP delegation mm-hmm. or the local initiative contract, or what you guys have mm-hmm. with your special plans around the Medi-Medis. Is that if there's only an MAPD plan option, will we have to re-enroll these clients, or will they be transferred automatically into the best plan possible, given, I'm assuming, again, those mm-hmm. MAPD plans? And since mm-hmm. I'm going to redirect it back to Shaina and to Elsa, being that they're deeper, obviously, into the MAPD world than LA Care is.
Yeah.
Can you answer that?
Yeah. So they will get transitioned over to a Medicare Advantage plan, MAPD plan. The challenge that the health plans face is making sure that 80% rule doesn't, they don't get more than 80% duals in that one benefit plan. So that's the challenge that all the health plans are facing. Except for LA Care. So
have to throw that in, right?
Yeah. So we have to crosswalk them into a plan that is going to be less than 80% duals on that Medicare Advantage plan. What Brand New Day is doing is all throughout California, we have a segmented option. So there's that core benefit plan, and there's going to be a -1 for Medicare and a -2 for duals. But because it belongs to a higher up segmented benefit plan, we'll be fine. And that's kind of our workaround that product has designed for us. So yeah, we're very fortunate to have that plan.
Thank you, Shaina. Let's talk a little bit about dental. I'll start with Jezabel on the dental side. We know CMC had that dental component. Mm-hmm. CMC is going away. CalMedi Connect Tell us a little bit about how the dental will work, or if you even have
so it'll
to the information.
Absolutely, it'll still be managed by Medi-Cal. The great thing is that was one of the CalAIM initiatives, is improving, the dental and the mental health benefit as well. So you'll see a lot of improvements in the dental, and it'll be very, streamlined. So
is it safe to say that your dental benefit will have a portion that's, I hope I'm using the right terminology, but that is part of the Medicare benefit plan, and then you'll have the Denti-Cal, the Denti-Cal side of the dental benefit, and you combine both to make it richer? How's that working?
Right. And also keep in mind that even the dental is considered part of value-based care. So, you will have providers that are incentivized for focusing more on preventive care, even as for the dental now.
Awesome. Yeah. Shaina, anything you want to touch on the dental?
So the way that our duals dental works is they first use their Denti-Cal benefits. Our plan does not interfere with it, doesn't cancel it out. They use their Denti-Cal benefits, and then Delta Care USA adds on to that. And we call it a wraparound plan because it kind of wraps around the Denti-Cal and provides all those extra benefits that Denti-Cal doesn't provide, like extra crowns, and we even cover implants for our dental. So a lot of extra things that, again, Denti-Cal doesn't cover, but they don't lose their Denti-Cal. So if they don't want to use Delta Care USA, then just forget about it. They're not paying for it. They can just forget they even have it and only use their Denti-Cal, and that's totally fine.
Awesome. And just for further clarification, you have the Medi-Cal piece on the Medi-Cal, but through the county, you also have the Denti-Cal component for dental. And it'll change based on state. For example, we have agents in Arizona. That'll be the access program. We can always dive deeper based on state, but what we're talking about specific to California. But in essence, it's the same, right? Coordination between the Medicaid, which is national, and the Medicare. Also, anything to share with us around dental?
Sure. On our connections plan, it is with Delta Care USA. It is both preventative and comprehensive. It doesn't have a limit. Over 400 procedures are part of the dental code, and most procedures cost sharing is zero. So it is a very robust plan.
Great to hear. Shaina, circling back with you, when will the members be informed of this change? I think you mentioned around September. That's when the official letters go out?
Yeah, we're dropping that the last couple days of September, so it's in their hands by October 1st.
Did CMS set specific date by when these letters need to go out? Is it a coordinated effort, or?
I believe it was September 30th.
Okay.
But not 100% sure, but I believe it was September 30th, or by then at least.
And I want to say, I think you had it in your slides, and I think you had it in your slides where you actually had timetables of when the letters are going to be going out.
Yeah, that was mine.
Oh, that was yours. Yeah. Okay. So is that copied from the CMS guidelines around this transition?
Yes.
Okay.
Yes.
And that's something that we can
September
share
30th.
individual piece.
Yeah, although the timeline will have other initiatives, for LA Care, it'll still have some other timelines that are specific to CMS guidelines. So,
yes. So that'll be a follow-up item for us to work with you individually and then sync that information together. So it's one messaging, right? So that'll be really important. I love this question, Jezabel. What happens if we do nothing at all?
So actually, I want to expand on that a little bit, because we're talking about, timelines. And, we've been talking to Brand New Day and Scan, where they have very unique situations, even though they don't have an actual Medi-Cal contract. They have decent plans where they can have their membership. But, CMS also set guidelines where plans that, do not have a Medi-Cal contract and have a lookalike and no DSNP to transfer, their members, that they must notify CMS whether they will be placing their members into an MAPD. And if they do not notify CMS, they will actually be transitioning to fee-for-service. Okay. And so I just want to call that out, because if you have members in other plans that this may apply to, I would absolutely call them as well, and just, know what's going on, because the last thing you want is for your members to drop into fee-for-service. Okay. So
from a continuity of care perspective, from protecting your book of business.
Right.
I mean, and maybe we can offline work on maybe a table where we can call out those plans that don't have the options that our panelists have here today. that are going to be impacted, because then that's an opportunity again for other agents to capitalize your membership, right?
And just overall, do what's best for the member. Even if they are going to be transitioned into an MAPD, it may not be ideal for a dual member to have, cost sharing or co-pays. And so you would want to do what's best for your member, obviously.
Can I elaborate on that?
Of course, please.
So just so you know, even if a plan does not have, if that particular plan is not a Medi-Cal contracted plan, they can't balance bill on the Medi-Cal side.
Right.
So they'll still have a zero cost sharing. They'll have to show both cards, but just understanding how the ancillary benefits will affect them, most definitely.
Mm-hmm.
But I do agree, do what's best for your client. And that's what we do for a living, is we put them in a better place. And the more you understand this space and how it works when they're going into just straight MAPD plan, the better informed you could be. Because the last thing you want is a call from your client saying, "Oh, I'm paying for something. I didn't know I was paying for this." So you want to make sure you are truly the content expert.
And you talk about being an expert. I would say that all of our successful agents are successful because they, by design, become masters at their craft. They become masters of Medicare. They become masters of Medi-Cal. I don't consider ourselves salespeople. I consider ourselves counselors, mentors, advisors. The sale, I think, is a title that doesn't really align with what we really do, because if you know the network, you know how to look up the prescriptions, you know how to do all that. By default, the person's enrolling, right? But we go back to retention, knowing your products, switching gears. About 70% of the book of business that iPros manages comes from our direct relationships with our providers, from the individual PCP level, from the IPA level, from the federally qualified health center, FQHCs. I think this is a real valuable question because we don't want to in any way disrupt those relationships or give the wrong impression, right? Because ultimately, as agents, it all falls back on us when these mistakes happen in these transitions. So I think this is a real valuable question. Will this create any issues with PCP assignments? And we'll start with Shaina. We'll all answer on that. But are you guys keeping that?
We're keeping continuity of care with PCP and medical group. That will not change at all for all of our members that are moving December to January. So don't worry about that at all. But we also are launching a short form within Connecture. So if you want to do a plan switch within Connecture, it actually omits the section for PCP and medical group change on that, because it's assuming they're going to continue with what they have. So we're doing everything we can to make that as seamless as possible. Yeah.
And I little shout out to our admin team, because we also use Connecture on our quoting and enrollment tool. So something that we need to take away as well in working with Brand New Day and how that.
It'll just make it easier if someone does want to be proactive and make that change, Brand New Day plan to another Brand New Day plan, and everything else is staying the same. It's just a much shorter form. It'll just take a few minutes to fill out.
Okay. And this is being recorded, by the way. So you're saying that 100% of the members will move smoothly, not one member will be.
Let's say 99%. Okay, let's leave a little room for just normal mess ups. But no,
good job. Good job.
It'll all be crosswalked over.
Awesome. Anything you want to add in regards to those PCP?
No, we are having automatic transition. So everybody from our CMC product will be, same provider, same PPG going over into the DSNP plan. And we'll be on Connecture too. So
Nice.
Awesome. Elsita.
Same network, and we are looking for a seamless transition. But as you guys all know, on the back end, we fix things like within seconds. You send us something, we escalate it, and you're on the communication to know it's now fixed and the transition is smooth. So even if there's little bumps, we have plan B to make sure we make it smooth. And we have the same investment. We want to keep your members. You want to keep your book of business. That's why we're all here today.
Well, great answer. Last but not least, what can we do? And I touched on it earlier. What can we do as agents when we receive calls from our clients informing us that they're receiving calls from other agents providing misinformation? Is that something you can take away with your management? to kind of work on a plan so that we can, I don't want to say, we don't want to be the sheriffs of the industry, but we also want to protect our book of business, protect the beneficiary. What can we do as agents to call out these folks that are showing up at people's homes?
Yeah. So we've been very proactive about that, very vigilant. Obviously, we have members calling in, letting us know. They give us the information from the business card that was left. And so, we do some investigation. We find out, are they affiliated? Are they one of our contracted agents? If not, what agency are they affiliated with? And then we sit down and we have those conversations because sometimes, it could be a matter of just, misinformation, and other times it could be intentional. So, for those cases that, are substantiated, then of course we're going to be escalating. And
shout out to our agents, by the way, that are not participating in these activities. So shout out to our agents. They know the CMS guidelines very well. We enforce them. And I think it's just respect to the industry, right? Absolutely. I've been around for a very, very long time in this industry, and a lot of the compliance guidelines are around these types of activities, right? But it's good. It weeds out the bad apples and it keeps us the good apples working, right? I'm going to turn over to our production team. Do we have any other questions out there?
Yes, there's a few questions. A couple of them for Scan, actually. So we'll just start for no pressure. Question from Augusto Medina. Clients in Plus Plan will be automatically transitioned to Connections?
If they meet the eligibility, if they have the aid code, the county code, they're over 65, absolutely. Because what happens is many agents place their members into Plus when they were under 65, and now they meet the eligibility, so it's just a matter of transitioning them. So very smooth crosswalk.
Thank you. Next question. And forgive me, I'm just reading the questions.
Let me just stop you there for a second. Is there any way that we can create a cheat sheet, a reference guide specific to carrier on these? A little table or something we could work on?
Yeah, actually we have them in our slides, like where they're going to transition to, and then we can actually provide we have all the information as resources. So Ruby and I are doing weekly trainings where we talk about the changes, where we're certifying for the fully integrated dual eligible plan connection. So we're able to do all the above.
And I'll take this back to our admin team, our tech folks, to see how we can add a resource link in iPros Connect specific to the transition by carrier. I think would be pretty powerful. That way they can easily reference it. Next question, please.
Next question from Jamie Figueroa. She's asking, will members on Plus Plan under 65, would they be allowed to enter Connections Plan?
They will not, because they don't meet the eligibility, but they will be crosswalked onto Classic. And we are creating some very special resource tools. If you've been on my training, you've got the sneak peek that will allow you to explain. If you have Medicare only, these are your benefits. If you have Medicare and Medi-Cal, these are your cost sharing. So instead of just what we've always done is, your cost sharing is zero, you'll have something concrete to share with them so they can understand that it's going to be at a zero cost to them.
Let me stop you there for a second. Shaina, under 65, same criteria?
Under 65 is totally allowed to enroll into any of our CSNP for duals or plans designed for duals. Because in other counties, we do have DSNP plans, just not in Southern California. So yeah, we'll take them all. Anyone you don't want to give to Scan or LA Care, we will take them and treat them well.
Thank you, Shaina.
Yes.
Next question from Sherry Tong is it's a little bit long, so I'll read it a little bit slow. Okay.
Wait, I'm sorry.
I'm sorry. I was calling out.
Shouting out. Go for it.
So she says, I foresee that clients with Scan Plus will not be happy to go to Classic Plan unless Scan Classic Plan is as good as Scan Plus. For example, skilled nursing facility, Scan Classic in-network is zero copay versus Scan Plus fee-for-service Medicare. The question is, when these members are transforming to Scan Classic, will these Scan Plus members are able to use fee-for-service or skilled nursing facility?
Yes. So I love this question because it repeats again. Remember, their cost sharing is going to be zero on Classic. whether it's the emergency room, there's a copay, whether it's skilled nursing, there's very few copays, chemo, radiation. They are going to have the zero max out of pocket. They're not going to have to worry about that. And since we're not allowed to talk about what class it's going to look like, I could just say I'm going to be smiling. And Medi members will be very happy under 65 to come to scan, to sane. But that's a great question. Zero cost sharing.
Zero cost sharing. One of the drawbacks of being live, almost all of a sudden I'm getting a cough attack here. So I'm going to step away for a second and leave you with the panelists so I can go get a cough
I
drop
thought for
here.
sure it was going to be me. I'm like,
Excuse me. We can edit that out, right?
It's live. It happens. Next question. This question is for Brand New Day from Farnas. She asks, can you clarify for Brand New Day the options? Sorry, first we need to mute Juan's phone because we couldn't hear.
Okay.
She's asking, can you clarify for Brand New Day the options are either MAPD or CSNP? They will not have DSNP, correct? DSNP, correct?
Yeah, DSNP. So Brand New Day, actually, we do have a legacy DSNP in LA, Orange, Riverside, San Bernardino, but we're not going to crosswalk the members there. Whichever members that were already there before the CalMedi Connect demonstration, we're allowed to stay there. But to answer your question, we're really promoting our chronic special needs plan for duals because the benefits are just as rich as any other DSNP out there. But with the CSNP, it's year-round enrolling. You can enroll them today for August 1st effective date. And they're safe there. The CSNP does not go away next year. If they don't qualify for the CSNP, we will have a Medicare Advantage plan that is designed with competitive benefits for duals, but it is filed as an MAPD plan. That answers the question.
Thank you so much, Shaina. If there's any more questions, please go ahead and send them through the Q&A box or the chat box.
I just wanted to also elaborate on Shaina's answer that we also have the chronic needs plans, the CSNPs. We will have the diabetic and the heart. And those will be excellent plans for your Medis that fit that criteria of chronic illness. And they can be crosswalked onto those plans, but they are county specific and provider specific, just as a reminder.
There's no other questions at the moment.
All righty. So the part of closing out this first of its kind of iPros TV, this panel, which I love. We'll start with Shaina. Any closing thoughts?
Yeah, just one exciting thing for AEP is that Brand New Day and Central Health Plan are merging certification, which will be launched early August, and it'll be online. And iPros is getting a Central Health Plan contract, so you will now be able to certify and contract with both brands and sell both brands in California. And we didn't talk about Central Health Plan today, but they also have a crosswalk situation as well. So if you have Central Health Plan members, they will be fine as well.
Thank you, Shaina. We were actually working on the official announcement, so thank you for.
Oh, I spoiled it.
But we're really happy. We're really proud of our partnership with Bright, along with Brand New Day, along with Central Health Plan. So yes, we will be contracted with Central Health Plan as an FMO. So more to come on that. More opportunities, not only in the LA market, but expansions in Northern California as well. So we're really, really excited about that. So thank you, Shaina, for your support as always. Jezabel, LA Care, we've been partners for many, many years. We were just informed that we were the top producing agency for the IFP, for the individual family plans in California. So that's big. So we continue to grow on the IFP side, which complements our Medicare side because these folks are aging in.
Yep.
So we're going to be able to put them with their respective plans depending on network needs, et cetera, et cetera. Excited about LA Care bringing back their DSNP.
Yeah.
Are you going to be the contact for our agents? Or who's going to be the contact for our agents on the DSNP product?
Yeah, so we do have field representatives who will function as broker support out directly in the field. Of course, I'm the point of contact for all of our agent partners. But we're very excited to bring our training forward very shortly. And I think everybody will be really excited with our benefits and our DSNP. And, just a reminder, we are a true DSNP. So under 65, no chronic conditions will take them as long as they have full scope Medi-Cal. So no share of cost, but full scope Medi-Cal dual eligible.
Fantastic. Elsa?
So just, I guess my closing remarks would be stay informed and know that the information is coming out weekly. So even if you checked in today and think, I'm good, I've got all my information, more information to come is probably what we should all be saying, whether it's going to be another training coming up or information going out to members. So please stay informed and please stay connected. But we're just looking for a seamless transition and keeping everything on your book of business.
That's what we're hoping for.
Yeah.
So we've come to the end of this session of iPros TV. This concept is around keeping our agents informed, empowering our agents with knowledge. Look out for the next session of iPros TV, which will include individual sessions around Brand New Day, around LA Care's reentry into the Medicare Advantage market, around scans, plans. So more to come on that. Thank you so much for taking time out of your busy schedules. Thank you, ladies. Very informative. We have 3 powerhouses here at the industry. We're really happy that they're here to help you, the iPros agent. So thank you again, and we'll see you in the next session of iPros TV.